I am Marwan Cameron, and this is The Conduit. All right, y'all. It is September 8th, Wednesday. We're in the middle of the week. It is 76 degrees in beautiful Kitsap County. Beautiful, beautiful day. Today, we've got a special show for you, coming to you in about 2 minutes. We are continuing our conversation around the 20th anniversary of 9/11. So very important for us to have these conversations. And Martitha May and, of course, Akuyea Vargas, who have now done this for 6 years, are coming to us to share a little bit more on what's going on. But we've got another guest today, Jessica Guidry from Kitsap Public Health. And so we're going to go ahead and get our folks in the room and get ourselves started here. We've got one more person to join, and they'll probably join us midstream. But let's go ahead and let them on in. Good afternoon, ladies. How are you doing this fine day?
We're doing great. Thank you.
Well, so glad that you can.
What about you?
You know what? I can't complain. I am blessed and highly favored. So it's as folks know, I'm battling COVID right now, and but I'm thankful, right? I've been vaccinated. I'm not hospitalized. I have high spirits. I have good folks like you, Martitha, and others looking out for me, and just doing the things to keep myself healthy and keep going forward, because those are the things that are most important, So
very quick, I would like to provide some updates.
Sure.
Because I'm going to be another course, but I'm going to be listening. So the update, we will not be providing vaccines on site due to insurance. They don't want us to do it. So no vaccines, but Peninsula Community Clinic will be scheduling appointments to get the vaccine on their clinic. So on site will be informational booth only and computers, to schedule appointments, but no vaccines on site. That's my update.
Okay, so that's important. So on Saturday, you will not be able to get vaccinated, but you will be able to make appointments, and of course, you'll be able to ask any questions that you may have, any concerns that you may have on the vaccine, the variants. These folks are very knowledgeable, very patient, and it's super important to have that access. So I know I have ongoing questions, and so please, they're there for that purpose. So use them.
And I would like to see Jessica. Oh, Jessica's connected already, right?
Yep, she is here.
Thank you, Jessica. And I'm gonna let you guys. I'll be here. I'm just gonna mute myself. Okay.
Yep.
Thank you.
No worries. So good afternoon, Jessica. How are you doing today?
I'm Marwan. Thank you.
I don't know if we met before or if we've been in a meeting before.
We may have been on a conference call together, but I've heard wonderful things about it.
Well, thank you. I appreciate you saying that. Half of them are true, and the other rest, is something else altogether. Would you mind telling us a little bit about yourself?
Sure, Marwan. Thank you. So, where to begin? So I work at Kitsap Public Health. I've been here for 13 years, a little more than 13 years. And for most of those 13 years, I've been part of our public health, the emergency preparedness and response program. So it's a mouthful. We call it our PEPPER program. But recently,
So what is that? Can you tell me, one, why was that position created, and what does that position hope to accomplish?
great questions. So the this position was created as a result of it's a Public Health Board resolution 2021-01. And this resolution was passed, I believe, in May of this year, and it declares racism as a public health crisis. This was a declaration that we got community input on. Various groups gave us input, both the Suquamish tribe and the Fort Douglas Brown tribe. I believe looked at both our first draft and our final draft. The Kitsap Vaccine Equity Collaborative also gave input. And I believe this was shared with other community partners, including the Race Coalition, which is very focused on anti-racism work. This declaration calls it out, says that racism impacts our community members, and racism has a direct link to health and to negative health outcomes to our communities of color. The resolution also basically talks about what the health district will do next. So not only does it talk about the problem that we have, and especially with COVID, we've seen racial disparities when it comes to hospitalizations and also to vaccinations as well. It talks about us creating a position, actually dedicating resources to a paid position that will focus on equity. It talks about us having an internal equity committee, because in order for us to even address racism out in our community, we have to address it within ourselves and as an agency, and to look at institutional racism. Are there things that we've been doing that we could do better? So allocating resources. The declaration also talks about what training the staff that we should start off with: anti-racism, cultural competency, and health disparities training. So that training piece also talks about how we will work with the community partners and the Kitsap Public Health Board to co-create solutions to address racism as well. And there's a whole bunch of other things for that declaration. As a result of that, my position was created, and also we've got a COVID, actually not COVID, we have an equity webpage as well that's got the declaration. It also has the call to action that our leadership issued. It was January of last year. It was after George Floyd's death. And the call to action with our leadership, standing in solidarity with our community of color, saying enough's enough. And that also is also on our website, in addition to the data on health disparities in Kitsap County. And also our community members can see what our racial makeup is, and our demographics of the public health staff. And our demographics are pretty close to the demographics of our community, and that dashboard will be updated twice a year as well. But a lot is still to be determined, and this is something where, as we do work internally, looking at our own policies, procedures, how we talk about things, how we think about things, enlightening ourselves as well. And then also having community conversations about what work needs to be done. That's where we'll come up with initiatives and whatnot. So at this point, I don't have a concrete list of external initiatives, but we have a long list of things we need to do internally to make us better partners to talk about this. So I hope I addressed all your questions.
No, you did, and I'll go a little bit further. But if you would mind, now, how long have you been in this position?
The equity program manager.
Mm-hmm.
Last month. So
Last month.
About a month.
So what intrigued you about this position? What made you say, you know what? Hey, it sounds like an interview all over again. Like, why do you think you're a good fit for this position? But what was the thing, like, you know what? Yeah, I want that. I think this is gonna make a really good impact, and I'm the one to do that.
So one of the reasons why I wanted to work in public health was public health's history of focusing on social justice. And equity in general is something I've always been concerned about. And throughout the years, been looking at it, and with my team members and with others in the health district and our preparedness program, and especially with our COVID response, the creation of the Vaccine Equity Collaborative, how we communicate. So but my interest in social justice is really what got me interested in it. The fact that this position also is more working with community partners of, with nonprofits, other kinds of community groups. A lot of the groups I've historically worked with have mostly been governmental, first responders, wonderful groups as well. This is a different type of community work. And it's work that I feel that's long overdue. And it's just something that really calls to me, and it calls actually to a lot of folks in the district. So it was the timing, it was the fact that it was supported by a resolution, and the fact that we were going to allocate resources to this, and also the opportunity to work with community members like yourself, like Akuyea and others, to really look at these issues. And you all have been dealing with these issues and addressing them much longer than I have. And so I really look forward to learning, to seeing what I can bring to the table and what the health district can bring to the table as well.
You said something really important there. Oftentimes, these initiatives they sound good and folks create them,
Yes.
but then they don't back it with creating a position, giving the position authority to actually suggest and make changes, and uh, sitting on in the meetings with kids at Public Health. It really
Mhm.
does sound like no, we're acknowledging this, and we really are intentional on moving in an equitable position and looking through things through that lens. So, I'm definitely super excited and happy to hear that Kids at Public Health is doing this, and that you're so passionate about it. Also, have you being here in this area for a while? Is there anything in particular that is like, what, here's, as folks kind of come into a position, it's like, so these are some of the things that I see, or these are some of the things that I would love to work on. Do you have any kind of pet projects, or, just kind of general directions on, what direction you want to see as far as this position is, and utilizing your power and advocacy to make change?
Wow. What a question. So let me think about this. One of the first things I really want to do, Marla, is learn about what others are doing. And Kitsap County is amazing. We have some incredible community leaders, and we have folks who've already been doing this work for a long time. And one of my hopes is to be able to meet with them and to learn. And basically, well, yes, I have my ideas, and I looked at the literature and got some ideas, but I really would love to hear from the community members first. I recognize, so I'm half white, half Asian. I recognize I benefit from white privilege, and there are things that I not see in my own personal experience. So for me, being able to listen is really important. And this is work that we've been talking about the health district in terms of have our community collaborative, being present at community meetings, also having community listening sessions. So which is difficult to do in a pandemic, but it's something we're looking into as well. So really, what I really need to do, I think, Marwan, is take a step back and hear what the community wants. And actually, the declaration was something that was called for by our community members. So I would like to continue that listening, and seeing what gaps can be filled, and basically how can we help elevate the work that's already been done. We also do need to, and as a public health person, I have to rally around data. So we definitely have to look at what data is missing. What can we look into? What can we share on our website? How can we respond to data that our community is interested in? How do we get it in methods that are accessible, also translated as well? So I don't know if that answers your question, but really, I feel like this is my time to be humble, to listen, and to learn, and to see where we can join our community members if there are opportunities for us to potentially lead, but really to participate and to be present.
So, would it be fair to say, thank you for that answer. Would it be fair to say that, this is a pretty broad umbrella? So, it could be the way that BIPOC folks or low income people are treated when they go to the emergency room, or their experience with the doctor, access to information. Is it really that broad in general as far as kind of your position, or is it more narrowed?
It's a really good question, Marlon. And based on what I've read in my position description and my discussion with my supervisor, this is supposed to be a broad position and really supposed to respond to um, what's going on within the agency, but also what our public health board requests, but then also what our community requests as well. And for folks who may not be aware, Kids at Public Health is a special purpose district. So we're not a county department. and we are governed by our public health board, which consists of all three of the county commissioners, the mayors of Port Orchard and Paulsville, and a representative from the Cambridge City Council. So we also need, since they were the one who issued the declaration, also want to get their feedback, but definitely want community feedback as well. And I think, Marwan, one of the things that is just being part of the conversation and bringing light to the situation. And this is where as public health we bring data, but also research and our community voices as well, that this is an issue. Because we need to continue having a conversation. I know a lot of folks haven't been in this conversation.
And what's interesting, Jessica, is in a lot of spaces the conversation hasn't even started. So the fact that that this is going to begin happening on a more intentional way is, like I said, just really super exciting. If I'm gonna bring Okoye in, if you would you said there was a web page or a website that folks could go to? Could you type that in the chat there, and I will go ahead and post that for everyone. And then if
Yes,
there
definitely.
if there is a place for people to contact if they do have issues or concerns or comments, what would be the best way to get that information into the hands of those that need to hear about it? If you have that.
Also, I definitely do that. Thank you.
And Okoye, you are here, so welcome. It's good to see you. You want to come off of mute and just say hi to the folks?
Hello, everybody. I'm kind of getting myself together here, but I just want to welcome Ms. Jessica. This critical conversation about what equity looks like within the health field and of the disparities and the historical pieces with the injustices and all of the differences that we see manifest themselves when we talk about health equity and what that looks like. We work so diligently to get the health district to work on the work of declaring racism a public health crisis. And what does that really mean? And what does that mean for all of us moving forward? Is it just a proclamation on a piece of paper that we declare, in Kitsap County, that racism is a public health crisis because of all that we've seen manifest itself during the pandemic? We know historically that we've always had these crises within the health, district and organization. So as we move forward, not to put anybody on the spot, but what are some of the policies and the procedures and the different things that we're going to begin to shift so that we make health a more equitable, accessible, you know, um, work here in Kitsap County? What does that really mean? What does it look like for us moving forward?
Yeah, absolutely. Do you have a question for Jessica? Okuya?
Yes, Miss Jessica. Again, we welcome you here. And you being in the position that you are now, do you have goals? What are some of the goals that you are setting forward, setting in place to be able to shift that narrative and address some of all of these concerns? And so that would be my question to Jessica. Have you gotten together to make those connections with the underserved populations to say we're putting in some directives and some goals to move equity forward in the health, especially in the mental health sector with communities of color, especially African American communities and indigenous and Hispanic communities. These type of different goals. What do we have? What's your vision for this work as you move forward?
Thank you so much, Akuyea, for those questions. And so to be really honest, so right now, my goals are based on what's in the proclamation. And I think the goals we'll have additional goals and revised goals based on conversations we have with community agencies, with our board, with community members. But directly, I do have a very basic work plan right now. And it looks at first, what work do we need to do internally as a health district to be ready for this? So, a matter of getting this position, setting up our equity committee, looking at training. How do we, racism is such a difficult topic to talk about. But how do we start having the conversations within the health district? How do we start educating our staff and talking about how race and health are connected? And, over the years, we've had conversations like this when we talk about it in terms of the social determinants of health or the factors, but really calling out racism and the impact that racism has on health. So my initial goals, Karen, are very much infrastructure in terms of going to our programs. So at the health district, we have, I believe, over 100 employees, around 100 employees. So it's a matter of going to the different departments to talk about my position. I don't know what y'all experiences have been when you have a new program or a new department in your agency and people are like, okay, who's this person and what are you talking about? And so one of the first steps, our staff have heard about our equity. Actually, this morning we had an all staff meeting where we talked about it as well. And this is not the first conversation we've had. Next steps, going to our programs, talking about how we have this equity committee that's going to look at and Karen, you're talking about our policies and procedures, looking at that, but using an established tool like the one established by GARE, which I believe is the Government Alliance for Racism and Equity. And I apologize, I don't have the acronym memorized, but looking at tools that exist and then assessing our policies, procedures, even things like our intake forms, we provide services. Are they inclusive? Things like that. So building this committee, looking at how we hire, are we a welcoming, inclusive agency? So there's that internal piece. And then, Karen, what I could definitely use the community's help with is how the health district should engage. There are already established wonderful coalitions, collaboratives, and whatnot. So one of my goals also, Karen, is to look at what work is already being done to see if there's any way that the health district can support, elevate, or just be a participant in this work. And like, for example, with the Erase Coalition that you've been such a tremendous founder and leader for. So looking at those groups that exist. So my hope is, though, Karen, at a future public health board meeting, I'll have more concrete goals, but establishing that the program internally and then coming up with a process for getting community input. This work is going to take time. And I know that can be frustrating considering this has been an issue for decades longer. And in public health, the research has been done about racism in health for around 30 years. So we've known this. We've got a lot of work ahead of us, but I really invite the community and especially you, Karen, as well, to give us input on what you would like to see. So I didn't directly answer your question there, but our initial goals are very much internal, getting us ready for also working with the community. And then with the community's input and our public health board's input, looking at what external goals we have and what issues we want to address.
Thank you. Thank you so much for that, Jessica. One thing that I don't like to just bring, problems of issues. How have we reached out to those that have been laboring in the field over in King and Pierce County, our neighbors, those that are working in the Odessa Brown clinics, and how they were addressing those disparities and how they were working with the medical field and organizations to make the impact and the change for those underserved community members and those that had, the hesitancy of trusting the health, districts and that history. How can we begin to start building those relationships and building some of doing that outreach to UW, pulling in UW and saying, UW, I know that you've worked diligently in these areas. What type of resources do you have? How can you help us to educate and begin to transform our organization here within Kitsap County and broaden those relational pieces and brought it even beyond Washington State and those that are doing the work on a national scale to be able to bring that expertise, like with Dr. Nichols and all of those that are doing the work in the health field around racism and undoing institutionalized racism in the health systems. And, there's a wealth of those that have labored for over 50 and 60 years to do this work. How are we, I know we're just starting this work here now in Kitsap County, but the wealth of resources, because I always say we don't need to start from ground zero. There are those that have labored diligently. How are we getting in touch with the health ministry, with our government, the minister of health, and all of those resources that are available to us? How are we beginning to do that outreach for our in-reach? And those are the things that I would love to sit down with you, Jessica, and let's do some visioning and brainstorming and doing the relationship building with all of those that can really help us, because we have an awesome opportunity. Kitsap County isn't that large that we can make a tremendous impact and transform the way we're doing things in our health district and those things that are needed. And so those are just some things that I just wanted to put out there.
Thank you so much, Karen. And, I really appreciate your point about how, not reinventing the wheel. And I mean, so far I've talked to my counterparts, equity counterparts with Tacoma County, Pierce Health Department, with the Washington State Department of Health and their preparedness program. They have an equity and social justice lead as well. But yes, I would definitely love to get your ideas, Karen, and we definitely need to have more conversations with folks already doing the work, looking at what we can learn, and then also hearing from our community about what might be unique in Kitsap County. So thank you so much, Karen, for that. Akuyea, excuse me, for those comments. Really well stated.
Yeah, I'd say a big one is just accessibility and knowledge. It's been an ongoing conversation that we've had, having information put in the language of those that need to have access to it, but also having access to it. There's things that as I do more and more of this work, I'm realizing, well, I don't know where I would go for information or if there's an issue. If we kind of transition a little bit, this Saturday is the 20th anniversary of 9/11, and Okoye and Martitha have been putting on the 9/11 SOS event, and that's this Saturday. And as far as I know, are you participating in this event this Saturday, Jessica? So can
Yes.
you speak to why it's important, either as an individual or as your position, to be represented there, and what does it mean to you?
So I said there are a couple of ways I can answer this, but maybe I'll take a look at my almost former position with doing public health preparedness. Before 9/11, health departments throughout the country were working on emergency preparedness, but unfortunately, with emergency response, often it takes a disaster to bring attention to issues and then funding. So after 9/11, local public health, state public health started receiving CDC funding for public health emergency response. So that event was one of the catalysts to really have not just public health agencies creating standardized emergency response plans, looking at what emergency management and first responders are already doing what we call exercises or drills and training, and having that kind of setting those kind of standards. So that really came after 9/11. I would argue that most natural disasters, no, actually I should take this back. I'll say natural hazards. And the reason why I say that is because it's the impact to people that make it a disaster, if that makes sense. So you have natural hazards like earthquakes, floods, but it's the social conditions of a community that make it a disaster, if that makes sense, because different communities may respond differently to a natural hazard based on what's going on in the community in terms of inequity, resources, and whatnot. So this event means so much in terms of honoring our first responders who are critical. They've been also critical, not just in this pandemic, but in every emergency and natural hazard you can think of. So it's honoring them, honoring the day, and the fact that we need to there's still work to be done. And we still as a community need to come together to figure out what, and to continue discussions on what it means to be prepared. And we're dealing with that now with this pandemic. So, I really appreciate the invitation from Martitha and Akuyea, because one of the things about this equity position also is being present and being in the community, being at community events. When I started at the health district 13 years ago, we had, for example, health educators who would go to fairs and public events to talk about the health district. Because funding has decreased over the years, and we've looked more at population health and doing larger policy and systems kind of things, we haven't necessarily been at as many events. So this is really exciting to me. This kind of gets back to the roots of one of my interests in public health and my first experiences at the health district, having colleagues who would go to events, have a table, have information out there. So I also look forward to bringing information. I will have bilingual information on emergency preparedness, but especially regarding health issues like food safety, drinking water, and whatnot that my colleagues have recommended. I'll have some information about COVID, but it's awesome that Dental Cal Services are going to they're going to be at the event. They're an incredible partner. And then I'll be there to answer questions about our proclamation, knowing though that we're still in the infancy of our program at the health district. But it's a really important event to celebrate and to remember our first responders. But it's also just to be with our community partners is really important.
So I wanted to ask you, and Akuyea, I think you were about to jump in there. I'm sorry about that. I wanted to ask you, when folks are part of an organization and they have a position, folks tend to kind of throw the kitchen sink at them. So if I have questions or concerns or thoughts and I see you, should I be asking you questions centered around equity in your position? Should I be asking you questions about the vaccine and the pandemic, as far as, recommendations? Should I be asking you questions about, what types of things should I do for me and my family, centered around emergency preparedness? Like, what kinds of questions are appropriate to ask you?
So Marwan, as a Kitsap public health employee, I want people to ask me questions, and I can let folks know if it's not my area of expertise, or if I think that the answer is better handled by like a public health nurse, for example, or someone on our vaccine team. I am happy to help with follow-up, and if folks would give me, maybe their email address or phone number, I can ask a member of the health district to respond. I definitely don't know everything. I have relatives who tell me that I don't know everything, and but I don't want people to feel afraid to be, oh, well, it's just only here to talk about blah, blah, blah. Please ask me. I remember Marwan, when I first started, I was actually at I think it was an employee health fair that used to happen at the Kitsap Conference Center. And I had people ask me about drinking water. And I said, I'm sorry, I don't know. Like, you don't know, you're from the health district. Well, you know what? I don't know, but I can definitely help people find answers. Now I know more than I did then in terms of where that information is. I'm not sure if I'll be bringing my computer with me, but if I do, and if I have internet access, I can, potentially look up information. But I can definitely, if I don't know something, I can definitely let people know and help them figure out how we can get that information to them. So I'm open to whatever questions folks have.
Awesome. Yeah, I think that's important, because a lot of times folks will see a person in a position and say, oh, it's I can only ask questions about that, so I won't ask that person a question. It's like, no, they're there in front of you.
Yes.
Ask that question, because they may have the answer, but more than that, they're likely, because they're connected, they're to it, they know where to get the answer, and they'll make sure that you end up getting the answer. So thank you for that. That's super important to state that. Akuyea, do you have a follow-up question or comment?
I think we may have lost her, Marwan.
Oh, yeah, I think you are correct. So we'll let her come back in here in a minute. I did see Martitha. Martitha, if you are still there, you popped in there for a second. I wanted you to have an opportunity to come in and ask a question. Oh, here comes Okoye back again. To ask a question or provide some commentary there, Martitha, if you are there. But Okoye, hopefully you heard what Jessica was saying there, and I wanted to kind of give it back to you to continue to ask questions or provide commentary on this topic. And we
Sorry, I had a problem with my connection. I'm back on.
no worries. Hey, it's technology. We just ride the wave, right? We just smile through it. So we shifted the conversation toward the event this Saturday, and we were speaking about why it's important for Jessica and for Kitsap Public Health to be a part of this, and we're also talking about emergency preparedness and emergency management. So, do you have questions, comments, or thoughts in regards to that for Jessica?
Hello, can you hear me?
Oh yeah, you are loud and clear.
Oh, yes. The importance here is that we always respond in a reactionary way whenever there's a crisis, whether it's a pandemic, whether it's Katrina, whether it's a man-made or natural disaster. Instead of really looking at our infrastructure, looking at our health districts, looking at all of those that are working within that field to begin to do some intervention and prevention. We saw many of the gaps during many different disasters, whether it was the pandemic, we saw the gaps between the underserved populations and those diverse communities that we needed to strengthen and do some outreach to and build and strengthen relationships. Many different things begin to manifest themselves so that they were very evident that we needed to look at our system, redo the way we were doing things, and begin to address it. And we always work in that way instead of doing a lot of preparation, like our communities here on Bainbridge Island. What they did was a 3-day preparedness that they do every year. And I know that those resources should be available to the most vulnerable populations within our county, but yet those programs and things are not accessible and they're not intentional enough to do the outreach. So to me, those are gaps. How do we begin to address that? Because we're supposed to be addressing our most vulnerable, our elderly, our disabled, our underserved population. Is just not about race or it's about human life. And how do we address that? We saw with Katrina, the communities that were given the information, given the resources, and was assisted to those ones that were not. So there are definite, things that we can be intentional about putting in place and not waiting till earthquakes and disasters and floods and fires and all of the, what, like I said, whether it's man-made or natural, to leave all of our communities in a vulnerable place. And I think that we've had enough wake-up calls in our nation to revisit our infrastructures and revisit how we're doing things, how we're working with our health district. Look how our health district suffered with this pandemic, to just be able to address those that were sick and in need, and then those that have lost their lives, and didn't even have enough beds, didn't have this, we've got to look at other ways of how we are doing. I know that we're creatures of habit and we kind of get stuck in, oh, well, this is the way we've always done it. But now is the time that we should be looking at how we can develop and create sustainable, impactful ways of doing this work across all the barriers, and removing those barriers and begin to say, okay, we got caught with our pants down, but now there were some learned lessons that we experienced just from 2020 with the pandemic. we now need to begin to say, we've got to look at these issues. We've got to address it. We no longer can turn a blind eye, and we've got to go in headlong how we're going to address these disparities. And so, I'm passionate about it because my community are the ones hit the hardest. And so it's our lives. And, I've learned this phrase, that, even in the military, you got to cut your losses. Well, we don't want to be the ones that's always cutting. We don't want to be the ones that always in the loss position. And we want to be able to live too. And so, when you talk about the sacrifice of service for the saving of lives, how we, my life is just as valuable as the next person's, I would hope. But, maybe that's not so, because I'm a different culture or come from a different, community. I would hope that, I could walk into a hospital and get the same services anybody can get, and not, devalue or my life is worth less than anyone else's. And so I'm very I'm passionate about how we engage in doing this work, and what ways will we begin to move and shift our communities and our organizations in a more healthy, equitable way to ensure that everyone's life is valued and protected. And so that's one of the things that I think we can do a better job at. We can definitely do a better job at. And one of the things I'm always reminded of is that photo that they always showed during the 9/11, when the towers came down and the ash was everywhere and nobody could tell what nobody was. It was just human life that was being lost there. And it wasn't about whether you're this color, that color, this culture, that culture, this race or that race, or any of those dynamics. It was about saving lives. And so I'm hoping that we can continue in that vein to be able to do that type of outreach and support for all of our communities.
So, I have a question for you, Jessica. As Okoye is reflecting on 9/11, I think of, this pandemic and the fact that, this Delta variant is just going crazy. We don't even know what the impact is going to be of this holiday. Usually it takes a week or two before we see the results of that. But we see, college football stadiums that are kind of full, and I just kind of feel like the numbers are going to continue to go in the wrong direction. More kids are being hospitalized. We're seeing our institutions, like our hospitals, our jails, where employees and patients and other organizations are coming down and getting hit with COVID. I've got COVID myself, and I'm pretty isolated as it is. With being vaccinated, we know that on Monday, the extended unemployment is no longer in place, which was a big help for folks. The moratorium on eviction is going to expire here at the end of this month. And we're going into, the cold and flu season on top of, this pandemic that we're dealing with. And now there's even this Mu variant that's out there too. And we don't know what that's going to do. Um, for our folks here, I'm very concerned as these protections start to expire. What is going to happen to the most vulnerable in our community? Is Kids at Public Health aware of these challenges, and what is any process or thoughts that you may have on how we can try to mitigate uh, what I see as this oncoming disaster coming up here in the fall, winter, and early spring of next year?
Wow. So, Tarbon, I'm thinking because, we are aware of the challenges, and you put them so well. Also acknowledging that I know that folks are tired of the pandemic, and it's just been really draining on folks. And there's the desire to try to find a new normal, and like I said, things are changing. We've got a lot of protections that are potentially expiring. I'd have to be honest, and I hate to say it this way, I have to check in with our leadership about this. I have not personally been involved in conversations that look at this larger picture, but I do believe that our leadership is looking at policies that I'll be working with our public health board on what we can do about COVID moving forward. But this is definitely something that I can check in with our leadership about, because you are so right, and looking ahead in terms of what challenges to come. So I can definitely get back to you on that. I don't have a good answer right now, but I think what I invite our community is to continue giving us feedback. We're so lucky to have folks in our representing various communities and organizations in our Vaccine Equity Collaborative. That the collaborative has been tremendous in helping to inform our work. Also, participating in our Kids at Public Health Board meetings, where there is there's a time at the beginning for public comment, but then also, reaching out to us via email, phone. But I will definitely, Marwan, bump this up my chain of command, just so I can get a better answer for you on this, because I think it's a really important question, and one that I don't have the answer for just yet.
And I appreciate that, and I think this is the opportunity, right? This is the change. Is, hey, that's a really good question. Let's see if we're talking about it, and if we're not, then it's a discussion that we need to start having. So this is the power of this position, and what can come of it. So like I said, that's why I said I was so very excited about it. And just as a quick commentary before I go to Martitha here, my cousin, she just started at a HBCU, and her third day she fell on a scooter, busted 4 teeth, broke her tibia, and she goes to the hospital, and there's no beds. And there's no beds because everyone that is there in the ER has COVID, and they're unvaccinated. And so however you fall on either side, whether you believe in the vaccine, you don't believe in the vaccine, if you're a masker or anti-masker, it doesn't matter. You're going to be impacted either directly or indirectly. And so the medical care that she needed was delayed and not fully given because of that. And we're seeing that everywhere in this nation. And so I think folks really need to be aware of that. Oftentimes we look at it as, we see the bad stuff on the news, and that's over there and that's over here. But no, it's here. It's in Kitsap County. It's in Bremerton. It's in Silverdale. It's in Port Orchard. It's in Bay Bridge Island. It's in Paulsville. It's Gig Harbor. It's here. So, we really need to be cognizant of that. And it really does impact you either directly or indirectly. When you need care, you're going to want to have that care. So please take care of yourself. Martitha, thank you so much for joining us. We were talking about 9/11 SOS. We were talking about emergency preparedness. You have questions, comments for Jessica as we begin to wrap up here?
Thank you. I just wanted to thank Jessica for accepting our invitation to be here, talking about equity and inclusion. And we are so grateful and blessed having, Jessica today, and the health district, the support that the community needs. I just wanted to congratulate you for your new position, and we are very, very, very excited to hear more about you. I would like to invite you to come to our, after the 9/11 event, our next podcast that we'll be having next week. We would like to have you back, Jessica. So I just want to say thank you for, your willingness to find ways how can you, from your position, can help meet the needs of the community. So I just want to say thank you, and gracias for all you do, and just so looking forward to see more with the health district. Gracias. And I just want to say, Marwan, thank you for the show. Thank you for being engaged with us, with the community. And it is all about diversity, inclusion, and equity. So thank you. We're looking forward to see you guys at the event on Saturday at 11, at 9:11 a.m. Saturday the 11th. So muchas gracias. Thank you.
Absolutely. I'm going to go ahead and give you the horn, Jessica. Congratulations on your new position. We're so glad to have you as part of the community. You asked earlier, what would be helpful when you wanted to talk to folks. From a selfish standpoint, for me, this is helpful because it gives that dialogue. We already had a question or two come up that you're going to go back and have a conversation with. And as folks view this podcast and see folks more often and see how accessible, and the fact that, look, this isn't lip service, this is what we're doing and this is what we're about. I think that is the way to repair and to restore equity. So as Martitha said, yes, we'd love to have you come on again next week, but I'd love to see folks from public health and other sectors come on as a regular basis to share information. And there's so many different things from an equity standpoint, right? There's policies and things that need to be done on an institutional level, but there's also just some of that just connection, being accessible, sharing that information out, that I think really is going to go a long way with making that difference. Because some of that institutional stuff, we know it takes a long time to undo what's been done for so long, and we get comfortable in what we do and the ways we do it. So to dismantle some of those things and change some of those things are going to be challenging. But I did want to also say thank you, and I want to give you the last word there. Any final thoughts for us out here?
Marwan, I really want to thank you for having this podcast. This is actually the first podcast I've ever done, so that goes. But we are stronger together, and I really want to give a shout out to Martitha and Akuyea. They are some of the most amazing women I know, and I've known them for a few years. But this work is going to take a long time. It might not go as fast as people want, and I understand that it's long overdue. But I really look forward to getting involved and learning more, working together, and we just need to take this, one step at a time. So really thank you all, and really appreciate the invitation to be here, and would definitely love to talk more in the future. And Martitha's going to give me homework, so I will make sure that I will follow up, and Karen's good at that as well. So we hopefully have more information for you the next time we talk.
All right. Well, we so much appreciate you for coming on. I'm honored that you are the first podcast. That the Conduit is your first podcast. That is so awesome. So I hope it is not your last one. Thank you again to Martitha and Akuyea. They are pillars in the community. They have been doing this work for a long time, not because someone told them to do, not because they're paid to do it, but because they want to do it, because their passion and their love lies in the people of this community. So thank you so very much. It's important. Join us again tonight, right? This is that momentum. The train has left the station, right? We've got another show tonight. We're doing 2 in a day at this point, right? And so tonight,
Yeah, you can join us at 5:00 too, Jessica. Pop your head in here and say hello to the team that'll be on, and because it's about relationship building as well, and they need to know who you are and need to know the work that you're doing as well. And so we welcome you to join us again as well this evening. So Marwan, thank you for having created a space for us to have these critical conversations within our communities, and that we continue to build and continue to do the outreach and continue to open up the airways for our community to be able to engage in these type of critical conversations for change. And so I commend you and thank you.
Well, I appreciate that. The name of the show is The Conduit, which is how I see myself, as just being that vehicle to which information and connections can happen. So as Akuyea was saying, join us tonight. We will have Carl Jacobson on from the NAACP. We will also have David Rasmussen back on from Kitsap County Public. Oh boy, I just butchered that. David Rasmussen from Kitsap County Department of Emergency Management. Woo, say that 5 times fast. So we're going to continue that conversation. And this is what it looks like. Please jump on the train. As you can see, the invitation has already gone out. So, Jessica's part of the fam now. That's how it goes. So,
Martitha, I think you had a little announcement about the 9/11, couple of changes. I'm not sure. Tom had texted me and wanted to make sure that we put that out for any listeners. And I give it to you.
Yes. I announced at the beginning, we will not be having the vaccines on site. We're going to be scheduling appointments for the vaccine to be taken at the local clinic, Community Peninsula, so clinic. So no vaccines on site. We're going to be scheduling appointments. So thank you so much, and gracias. Akuyea, thank you. Just so grateful that we both working together for one purpose.
Always,
for the community. Gracias.
Many hands make light work. That was Miss Opal Robertson's favorite
Yes.
quote. And Jessica, I'm not sure if you were here back in 2007 in this area working with our health district, but at that time we were trying to open up the airways for the health district to come alongside African American community and community leaders, diverse community leaders, to address the disparities. And so you have now been given the baton, and the race is still on. And so come in, and if there's anything that you ever need from us as well, we're here to support you as well. And so I want you to know that you're not in this race alone. We're here to support you as well.
All right. For Jessica.
Gracias, Jessica. Thank you, Martitha.
For Jessica, Akuyea, and Karen, I am Marwan Cameron, and this is The Conduit. We will see you tonight at 5, everyone. All right.